This week's muscle breakdown, I'm going to be covering a very important muscle in the rotator cuff, one of the primary stabilizer muscles of the back part of the shoulder, the infraspinatus. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that allows them to easily double their income, all while working 50% less. Back at it for my muscle breakdown. This week I wanted to cover a really important muscle in the rotator cuff, specifically the infraspinatus. So the infraspinatus is classically considered like an external rotator of the shoulder. And yes, it does do that. But what I really see the infraspinatus as is a primary stabilizer for the back part of the shoulder. So where the infraspinatus lives, I had my model out here. Let me make sure I do it right. So this is the back part here. We got the spine of the scapula, medial border, lateral border, inferior angle, and it really sits in right through here. And it's really an important muscle for overall stability. Over time, just with bad postures, overuse, a lot of people are spending a lot of time like this. The infraspinatus is just getting overworked. And when the infraspinatus gets overworked, it doesn't get enough blood flow and it doesn't get enough oxygen. When that happens, it starts this whole, I'm going to get real fancy here. It starts this idea of hypoxia. So hypoxia just means it's not getting enough oxygen. So it sends a signal to the brain. The brain actually starts to send down immature collagen fibers and they form scar tissue. Now, scar tissue gets inside the muscle, makes the muscle really weak, really inflexible. So then what happens over time is as that muscle starts to go forward, it puts more wear and tear on other parts of the shoulder. So a lot of times you're going to see dysfunction in the supraspinatus. You're going to see a biceps problem. You can get more wear and tear in that subscap as well. So a lot of people that have rotator cuff tears or dysfunction without a lot of trauma, I'm always looking for where the biomechanical problem is. And a lot of times it started as a problem in the infraspinatus. So the infraspinatus is really important. Anytime you're pressing or reaching, what it does is it kind of holds that back part of the shoulder down. And if it doesn't have enough force generation because of scar tissue, it puts more wear and tear on everything else out there. So a lot of people end up getting like bicep tendon repair, or they'll get supraspinatus repair, but that problem comes back because the dysfunction is actually in the infraspinatus. Now, the thing about the infraspinatus, and I see this all the time, is that practitioners don't treat it correctly. They're actually not palpating it correctly, and it's very thin. It sits right on the base of the scapula. So as I've shown here, it sits right there and it's really not that deep. What I end up finding is that people palpate it too aggressively, or they actually have trouble locating it, even though there's a lot of good, easy landmarks to find that. So what I wanted to include in this week's training is a detailed palpation of finding the infraspinatus, because if you find it and you find dysfunction, you can fix it. So I'll link that up right now. So we got to look at the shoulder. We looked at that shoulder abduction test, which is really important. Now, when this test is limited, we talked about the things that could limit it, but if it is a tissue problem, we're going to get in there and do a palpation on the muscles of the rotator cuff. So the muscles that I'm most concerned with are going to be infraspinatus, teres minor, the joint capsule on the backside here, and then subscap. So the first thing we're going to do is just get in there and palpate the infraspinatus. So one trick that I like to do is I like to have a little bit of tension here. So I'll have the patient just kind of reach around and open up their arm. That gives a little tension on there. And then what I do is I just find my landmark. So here, across here is the spine of the scapula. So I know infraspinatus lives anywhere in through here. So what I do is I just get in there and I'll just sink in and palpate. And what I'm trying to feel for is areas of decreased compressibility. That lets me know that's area of scar tissue. And there's a pretty good one right there. I'll check that whole muscle. Now, teres minor, this one is a little more difficult to find, and usually it's a little tender as well. So what I do is I find the lateral border and the inferior angle of the scap. So that's right there, and the lateral border's here. So here, I'm still on the scapula, but then I'll roll off and I go underneath. Now I know that I'm off of it. So what I'll do is I'll pick my thumb up right there, and now I'll be able to get in here and do my compressive palpation down through here. The majority of what we're going to find is right in the meat of that infraspinatus, and sometimes there will be what's called a junction scar tissue spot where the teres and the infraspinatus come together right through there. So I hope that video was really useful. And like I say, you can't fix a problem if you can't find it in the first place. And the first step is getting in there and being able to palpate it correctly. So a couple errors that practitioners make when treating the infraspinatus is they're too compressive. So in order to break scar tissue down, you need two components. You need proper depth, then tension. That's what we teach in our method called the peak method. That's what we start with on day one, is getting proper depth, then tension, because scar tissue to actually break down needs tension to break it down, not just depth. So most people are way too compressive, and then what happens is that tissue can't slide underneath there. And when the tissue can't slide, it becomes compressive. It hurts like hell for the client, so they think you're doing something, but you're actually not doing anything at all. So another problem with treating the infraspinatus is it has like a 45-degree tilt. So what happens is you kind of have to bias off with your depth and your tension to accommodate for the tilt of that shoulder. And a lot of times people go straight in and then they get too much depth and too much tension on there. And you want to get the optimal amount of depth and tension. If you don't, you're not going to get an effective treatment. Take homes from this week's video is finding it, knowing it's a problem, and then getting in there and being able to get the right amount of depth and the right amount of tension. Just understand that some muscles don't need a lot of depth because they're right there on the surface. And there isn't a lot in there between the skin and the subcutaneous fat and then the infra. It pops right up. It's one of the easiest muscles to find, but it is difficult to treat if you don't account for the vectors of the angle of the shoulder and you're too compressive and you don't get proper tension. So hope you guys enjoyed that video. If you like it, give it a comment, a like, a share. If you want to get access to some of our free training, learn more about our critical thinking, palpation, functional tests, all that is linked up wherever you're watching it. Go in there and grab it. It is totally free, no obligations, anything like that. If you have any specific muscles that you want me to cover or share, send me a message. We're always here to help. And I appreciate you guys watching this, and I'll see you on the next one. Bye.